Hello, good morning, dear doctors. We are here today to discuss a very important topic in station number 4 basis exam. This topic is methotrexate counseling. It is a recurrent topic and contains a lot of tips and tricks, hidden agenda, and a lot of concerns. Let us go and explore more about this topic. What is methotrexate? Methotrexate is considered as an antimetabolite agent, but when you will talk to the surrogate in station number 4, you will tell him that it is a medicine which has multiple uses and it changes the activity of the defense system to decrease the attack of body organs and also the lining of the joints. Methotrexate has a lot of uses, especially in cases of rheumatoid arthritis, Crohn's disease, and psoriasis, and cancers also. Methotrexate has multiple forms. Maybe it is a tablet form and injection form, but in pediatrics it can be present in syrup form. So in internal medicine we will concentrate about tablet form and injection form. The tablet form has different strengths. It ranges between 2.5 and 10 milligrams. Doctor, how can I receive methotrexate? It is a very important question to tell him about the method of administration of this medicine. Methotrexate is one of the medicines that is received only once per week, and you should remember this very important information that you will take one dose each week on the same day of the week, and the doctor will choose how to start with it according to the strengths. Okay, and what is the recommended dose you will start with it. It can be taken before or after meals. You should remember to take it at the same day every week. And if you missed one dose, you can take it as early as possible, especially in the first 2 days. But if you missed it with more than 2 days, so at that time you should contact your doctor. Methotrexate may be not suitable in multiple conditions, and you should be aware of these conditions. If you are pregnant or intended to have children in the future recently, so methotrexate will not be a good choice to start with. If you are a breastfeeding mother, so methotrexate will not be a good choice. If you are having an infection, which may be sepsis, also methotrexate is not a good choice. If you have a peptic ulcer, which is a stomach sore or food bag sore, methotrexate is not a good choice. If you have any problems in your liver or your kidneys, methotrexate is not a good choice. If you are allergic or used this medicine before and suffered from a reaction from methotrexate, so methotrexate will not be a good choice. If you have a blood disorder, for example, hemolytic anemia or any blood disorder affecting your hemoglobin, so methotrexate may not be a good choice for you. What are the side effects of methotrexate? Methotrexate is one of the medicines that has a multiple side effects. It can cause nausea, vomiting, it may cause mouth soreness, elevation of body temperature. Okay, it can cause scarring of the lung tissue, that is lung fibrosis. It can cause a skin rash. There is a very important information that you should know. It may cause elevation of the liver transaminases and may cause liver failure on the long run or liver cirrhosis. And don't take with it medicines especially that is interfere with folic acid metabolism like cotrimazole or trimethoprim, because these medicines will lead to a bone marrow failure. It is very important, and there are a lot of cases of co-administration. In this case, we will consider it as a negligence. There are a lot of advices you should follow and give for the patient who will receive methotrexate. During receiving this medicine, he should stop drinking alcohol. Number two, avoid pregnancy or fathering of babies during receiving this medicine. And if they are planning for pregnancy, they at least stop this medicine for about 6 months. And during receiving this medicine, they should receive a contraception method, which is very important. Don't receive a live attenuated vaccine because methotrexate is one of the DMARDs that may cause immunosuppression. We should offer folinic acid during methotrexate treatment, but don't offer it on the same days of the dose because it will affect the dose effect. If you developed any mouth sores or fever or jaundice, you should inform immediately your doctor. There are a lot of precautions you should follow before starting and during the treatment period of methotrexate. The first one, before treatment, you should offer for the patient pregnancy test, especially in female patient, and HIV test. And we should also do CBC and liver transaminases and kidney function test. And the chest x-ray can be done. We should monitor during the treatment period of methotrexate by regular follow-up of the blood count and renal and liver function tests. We will ask for them every 1 to 2 weeks till stabilization of the condition of the patient, and after stabilization of the therapy and the condition of the patient, we will regularly follow up it every 2 to 3 months. Chest x-ray and respiratory function tests are very important to be done every year, which is annually. Okay, there are a lot of concerns in this station, and the patient may ask you a lot about methotrexate. First one, is there an alternative doctor other than methotrexate? I wanted to tell you that methotrexate is an effective medicine and can help you to control your medical condition. But the alternatives may not be on the same level of methotrexate. So I will prepare for a meeting with my consultant to talk with him about the alternatives and if these alternatives is good for you or not. I don't like tablets, doctor. Can I receive herbal medicines? I'm afraid to tell you that herbal medicines can't control your condition because the root cause of your disease is your defense system is attacking your body organs and your joints. So the only way to change the behavior of it and control this disease is by giving methotrexate. Will this medicine cure my condition? I wanted to tell you that methotrexate can control more your condition and prevent the progression of your disease by changing the activity of your defense system. So it is very important to know that this medicine is for controlling your condition. In some cases, especially the defense system problems, if you stop this medicine, maybe the conditions may flare again and may progress again. So it's very important to be on this medicine to control your defense system and don't stop from yourself or stop it suddenly. What is the difference between injection and oral one? Both of them contains the same medicine, but the method of administration is different. But methotrexate subcutaneous injection is advised only by a specialist, and it is reserved for the patients with tummy side effects. They suffer from a lot of days in the week due to this medicine by sickness and sense of throwing up, or maybe not responder to the oral therapy after 8 to 12 weeks trial. So we may go for injection under the skin. So this is the difference between both of them, but both of them contains the same medicine and gives the same effect. So these are the most important information about methotrexate. Thank you all doctors.